The deadline is looming, February the 3rd, for frontline health and care workers to have had their first COVID vaccine dose. By April the 1st, they're expected to have had their second jab, the definition of fully vaccinated. But the Homecare Association is warning that if the government pursues this policy, up to 100,000 home care workers, the ones who go into a person's house, will leave. In a letter to the Health and Social Care Secretary, they say the government has seriously misjudged this balance of risk. We are deeply concerned that the safety and well-being of older and disabled people will be dangerously compromised by the loss of 15 to 20% of the home care workforce. And we believe that the risk of hospitalisation and death from COVID-19 among people receiving home care, particularly those who have been triple vaccinated, has been overstated and is unsupported by the evidence.
The sort of vibe of the message is, the pandemic is coming to an end. Some people might not agree with that, but that is the stance the government has taken. And therefore it seems inconsistent and incongruent, really, to start implementing complex regulations when you've more or less said the risk is much, much lower.
Last week, Channel 4 News fact-checked estimated that up to 52,000 frontline NHS staff could be redeployed or sacked under England's vaccine mandate. There are some who think this is a matter of who will blink first. The health and care staff who face losing their jobs, or the government. This is, after all, a sector with severe staff shortages. But today, the line from Number 10 remained that they will stick to those dates, that this is a policy that needs to be brought in because it is about protecting society's most vulnerable.
Hello, good morning.
The Prime Minister visiting Milton Keynes Hospital today announced no more testing for arrivals in England for the double jabbed, and it will be the same in Scotland.
Although we have to be cautious, we are now moving through the Omicron wave, and you can see the figures are starting to get better. So what we're doing on travel, to show that this country is open for business, open for travellers, you will see changes so that people arriving no longer have to take tests if they've been vaccinated.
Infections, however, do remain high, more than 80,000 today, and most recent figures show cases in children aged 5 to 9 have almost doubled in a week.
Because the virus, particularly with the Omicron variant, is so common in the population, sure, we're seeing lots of children coming into hospital with something else who've been found to be positive. But my own personal experience, the experience of colleagues, and we've got routine, there's routinely acquired data but it isn't translating into admissions of children.
Next Sunday, it will be 2 years since the World Health Organization declared coronavirus a public health emergency of international concern. And today, the Director General warned it was dangerous to assume the pandemic was near the end.
There are different scenarios for how the pandemic could play out and how the acute phase could end. But it's dangerous to assume that Omicron will be the last variant or that we are in the end game. On the contrary, globally, the conditions are ideal for more variants to emerge. To change the course of the pandemic, we must change the conditions that are driving it.
But he said it was possible to end the acute stage this year with vaccines, testing and medicines.
What does that look like? It means achieving our target to vaccinate 70% of the population of every country with a focus on the most at-risk groups.
And yet there is a yawning gap between wealthier nations and countries like the Democratic Republic of Congo, where just 0.2% of the population was fully vaccinated by mid-January. That is a long way from the WHO's target.